Hello, my name is Bennett Hooks, and I'm a gastroenterologist at Diagnostic Medical Clinic, here today to talk about colon cancer screening. March is Colon Cancer Awareness Month. Colon cancer is the third most common cancer found in the United States, and it's the second most common cause of cancer death in the United States. In fact, in 2013, as many as 50,000 people will die from colon cancer. And it's been proven in studies that up to 80% of those deaths could be prevented with colon cancer screening. Before we get to screening, let's talk about what happens with colon cancer. Typically, polyps start to grow very small, and over years, not months, but years, they can grow into the wall of the colon and then through the wall of the colon, get into the lymphatic system, and then spread to other organs. So our goal is to find the polyp or the cancer early so it can be removed without evidence for metastatic disease. Why is there so much in the press about colonoscopy versus the other types of screening? The main reason is that through studies, the most recent one was in New England Journal of Medicine in 2012, showed that your risk of death from colon cancer is reduced by 50% if you have proper screening with colonoscopy and removal of polyps. During the colonoscopy, the gastroenterologist will insert the tube, go through the colon, and look for polyps, and they'll be removed during that time, taking away that risk. You get both primary screening and secondary prevention by removing the polyps. A lot of people get upset or think about having to prepare for the colonoscopy, and that's one of the drawbacks for having the test done. There are new preps where you're not drinking a gallon of fluid and actually get better results. Which people are at risk? Which people need to be screened? If you have a family member, a first-degree family member, that puts you at significant increased risk as opposed to the general population. Puts your risk about 4 times the general population for developing colon cancer through your lifetime. If you don't have a family member, you still, with colon cancer, you still have a 1 in 20 lifetime risk of developing colon cancer. So the current recommendations are at 50 years of age, or younger than that at 40, or possibly younger if the first degree relative was diagnosed at an early age, you should have colon cancer screening. So if you're 50 years of age or you have a first degree relative that has a history of adenomatous polyps or colon cancer, please contact your physician so that you can undergo screening. The best screening test is the one that gets done. I've put together a couple websites and our clinic office number for you to review. So please remember March is Colon Cancer Awareness Month and get screened.